Should animals be temporarily put to sleep for radiographs to lessen human exposure? Go ahead and start us off, Sage.
Okay, so when we say temporary put to sleep, we're talking sedation.
Oh, yeah, that was awkwardly worded. Sorry. We can't temporarily kill a patient. I guess we... Anyway, go ahead.
So, sedation.
Sedation.
Should we sedate a patient for radiographs? Yes. I think yes, because it is safer for the pet. It's safer for the person doing the radiographs. There is less radiation exposure, and we're already getting a lot just because of the patients that we do have to hold and restrain for that, and all the ultrasound that we're doing, and just like all the things when we do like dental radiographs, well, like GPs. I feel like it's just safer on that part just for radiation exposure, but then it's also safer for the patient because the positions that we have to put them in can be uncomfortable. They can be scary. Like we have to put them upside down. If it's any ortho procedure, 100% yes, because we're pulling on their legs. We have to straighten them out. Yeah, we're cranking them. And especially like when we have patients with like any suspected like breaks or fractures, they 100% need drugs. And I hope...
Especially on like the spine.
Oh, yes. Yes. And I just feel like it can be really uncomfortable, and you're able to get a lot better imaging. It overall is going to be very worth it, in my opinion, to do sedation just because like your image is going to be better.
Yeah.
And it'll be more diagnostic. Yeah. Overall.
What do you think, Samantha?
I mean, I agree. I think it also limits the exposure for the pet because you don't have to keep retaking.
Yeah.
And retaking.
Yeah.
Retaking. I mean, there's definitely times when you can't sedate a patient, but it's all patient dependent. But
Right.
Have
you guys being at this hospital with the protocol as is pretty much every patient is sedated? Have you noticed any issues with that at all? Have you seen any?
I've never had an issue. I know some other nurse has had an issue where they sedated it. The patient turned blue. We ran him down to the ICU and everything, and we just gave him some oxygen. Run. It is a far run. There's doors.
Imagine.
I've had patients not do great in radiology, but I mean, they weren't doing great anyways.
Yeah.
And when they're not, like when they're super critical, we give, I mean, even like the most mild sedation is beneficial.
Yeah.
I just wanted to see.
Even like the most mild sedation is beneficial. Like even just if they're on a fentanyl CRI, like giving them a fentanyl bolus. Like,
yeah.
Even just to, I mean, we have a bunch of things like sandbags and stuff like that we can use to help restrain them. But that's scary. Like it's scary for these animals, and they're already under so much stress, and it's not going to help in their healing or anything to put them through more stress. So
honestly, I would have preferred that. I know you didn't do radiographs without.
I've done them for some patients without it. Just
Crazy
because
patients?
like the doctor didn't want sedation. So I was like,
really?
So I was like, I'll try it without sedation, but like I'm not trying that hard because I'm not going to break my back over this when we can just sedate them.
The very short period of time that I worked in GP, we never sedated for radiographs. And
I wonder if other ERs, do you know if the one you're going to sedates?
Occasionally.
Like
they'll give it to them if it's needed, but I believe
they just kind of try first.
They want us to try without first, which I mean, like, isn't wrong.
Yeah. I feel like that's a fair protocol.
Yeah, like I'm willing to try anything.
Anything?
I'm willing to try anything in vet med. Like if we want us to try without sedation and everything first, then we can do that.
If the dog or cat can handle it well. I mean, I've had patients that
are really calm.
Where like we're not gonna have to sedate this dog, not because they're sick or anything, just because they are happy to be existing in life, and they're just a stupid golden that doesn't care what we do to it, and it's fine. It's fine to go on its back.
Like, I'm getting a big hug.
Literally,
it's okay.
Yeah, there are patients that don't need it, and if you're you're not doing like ortho-rads or something, then I think it's okay. I don't think there's anything wrong with seeing how they do without it, but
Agreed.
I've definitely been kicked in the face when I was trying to get
I've been bit. You have been bit?
Yeah. Like not hard, but like they
Ugh.
just are.
Yeah.
But
Fun times.
I love it. Wouldn't trade it for anything. I was gonna say something, but I don't remember what it was.
Don't cover your mouth.
Oh, my bad. I do see a lot of times in like like Facebook groups that like I'm a part of. They'll post like radiographs and everything, and I feel like you can definitely tell when there was sedation used and sedation not used, because a lot of the time it's like dogograms or catograms where it's basically like the entire body, and I just get confused. I don't know what they're trying to take pictures of, where the focus is, if we're trying to look at the abdomen, if we're trying to look at the thorax, what we're doing. And I feel like that's like another thing that sedation would help
any of
with.
your pets ever had to have sedated radiographs?
Mine are perfect baby angels, so no.
Mine, I did my own cat's radiographs by myself, no sedation, because he is naughty and I had no money. So I was like, no one help, I need to get as much money off as I can.
That's fair.
Cooper had to have his hips done when he was younger, and he was sedated, and he did perfectly fine with it. And as like, I mean, this was before I was even in tech school, and as like a client, I personally had no problem with it, because I mean, he did perfectly fine with it. He was a little sleepy on the way home, but I had no problem with it.
I just remembered that this one time we had a dog that was only good with mom, and she had some vet experience. So my doctor's like, let's just try and bring her back there.
What?
To get radiographs?
Yes.
That's like not illegal.
That's illegal. You need a little badge. Maybe should I not say that? Anyway,
Nathan, erase that part.
Scratch that. Anyway, I don't know where we left off, but let's continue forward. Is this no?
That's me.
I definitely thought that was Jambo.
That's my phone.
You were
Hello. I wasn't gonna move.
So dealing with a neglectful owner. We're getting a little bit sad in here. What are the appropriate steps to take if you suspect animal abuse?
I feel like we see so many of these.
There are
and
so
it's
many.
so sad.
I think that if we suspect animal abuse, we should report it.
You contact animal control.
Yeah.
Do you guys ever contact the police, or is it just animal control?
So we're not the ones that do it.
Yeah.
It's
So
the doctors, right?
we aren't actually involved in any of that part.
I know.
But
We tell the doctors, and I say, this isn't okay. Like,
So-
are we doing anything? And they say yes.
Okay, so in
I
general,
just feel like it's really specific.
I think that it is our responsibility or the doctor's responsibility to, if we suspect it, we should report it, because you have no idea. They could have more animals at home.
Yeah.
But then also, I was involved in a case, I won't go into specifics, a couple weeks ago, where it was just like the person was either homeless or like just became homeless, or like it wasn't actually his dog, and he just picked up this dog and found it in this condition. And so we're like it was like his ex's dog or something, and he just like got it back and found it in this condition. So we're like, we do not know what's going on, but this dog has been severely neglected. Like, what do we do in that situation? Do we call animal control? Because like if there's more animals, they ended up euthanizing this dog, but if there's any more animals,
Right.
we need to get them out of that situation. But then also, another nurse pointed out to me that we should look at it more, not just from the animal perspective, but also from the human perspective. Like,
Right, of course.
should we be contacting authorities to do like
Like a mental health check or something.
yeah, like to check in on these people?
Right.
Are there children involved in these cases? Like, stuff like that. So I think that it's, I mean, one of the hardest things that we have to deal
Yeah,
with in vet med.
of course.
And I don't think anybody exactly knows how to
I have whole
approach it.
classes every semester that are literally like ethical, like
Really?
these
Yeah.
scenarios. Like, how do you do it?
Yeah, and
we
I
just
think
had a lot of euthanasia classes.
Yeah.
Yeah. But I think that we have to look at it both from like the animal, obviously, because that's what we do, their perspective, but then also from the human perspective.
Yeah.
Like what is going on in this house that this was allowed? Are these just really bad people, or like do these people need help? Like
Yeah.
do these people
Of
need
course.
further help?
Yeah. I feel like that part we don't think about as much just because
Yeah.
we see like the animal and that's all that we like, especially like us, like we don't really interact with clients that much unless like they come back and they're visiting.
Right.
So it's a lot harder for us, I feel like, to think about it from like the owner's perspective.
Yeah. And I think that we all of a sudden, get super defensive for the animal, which
Yeah.
we should. But
We need to think if we should be helping them too.
yeah, or if there's any other people that are like, especially with children, like, what if
Yeah.
there's children in these situations, like where this dog came from?
Okay, so we had a patient that was in a car accident, and I feel like this one also really relates to
Yeah.
helping like the owner
Exactly.
because the dog's owner was a man who had recently
Been released. Or
creatively released
Yeah.
himself from a mental institution.
he escaped.
From a mental institution and had stolen a car, found this dog from some breeder.
Refer to our last podcast on responsible breeding.
From some breeder, not sure how, and then proceeded to get into a car accident going 50, 60 miles an hour.
While the dog was in the car with him.
Yes. The dog had ended up getting euthanized due to like his condition that he was in, but also
But not really.
the kids took the owner's kids decided because the man was not able to make any decisions appropriately and was currently in the hospital. So that one was really, really sad just because there was definitely something that could have been done for this pet. It was not that bad
Right.
that we knew of.
Right.
Like he could have had like some other like massive injuries, but from like our physical exam and just assessing this patient, we could not like physically and like through ultrasound tell if he had any more serious injuries. We weren't able to just see if he like didn't have any hemoabdomen, he didn't have a hemothorax, he didn't have a pneumothorax that we could tell. So I feel like that one was just really sad because there was definitely something that we could have done, but we couldn't just because of the owner's situation mentally.
I think they just kind of wanted to do like at least a point of care blood work and then
No.
radiographs. No, like that's what we wanted to do initially. Yeah. Like it.
And we also aren't allowed to discuss surrendering at our place of employment just because that's their like their rules and everything, their policy. Other hospitals do allow you to do that, so I feel like that's also like the tough situation. We didn't really have that option, and we tried giving other options of like you can always take them to a shelter. They didn't want to do any of that, so the most humane thing that they decided to do was euthanasia.
Yeah. The worst part is it was like a 6-month-old.
It was less
puppy.
than 6 months old.
Yeah.
Like it had to be. It was really, really sad.
Yeah.
You kind of looked like my dog.
Yeah.
Not gonna lie, I cried.
Yeah.
It was really bad.
You were there. You just were kind of off.
Yeah, I was working on a different case.
Yeah.
He looked like one of my favorite patients ever, though.
Yep.
Oh.
Definitely reminded me of him.
Yeah.
It was very difficult.
So, And there's also like a difference between like neglectful versus like straight up abusive too.
Yeah.
Yes.
Because there's obviously ones that are like not meaning, like not purposefully like abusing their or like, what's the word? Like they're neglectful, so they're not like purposely like hitting the dog.
Yeah.
But they're
Right.
just like not paying attention to it. They're not doing like veterinary care. They're not.
Yes. I can speak on that one because Loki, my baby angel, he came from an abusive household. Well, I would say neglectful. He was locked in a small cage with 2 of his siblings and everything.
Did you know this?
No.
I didn't know either.
This is why I
He's a
can't
precious angel.
I can never punish him for anything. I'm like, you're perfect. Like,
He's just
I
a
love
kid.
you.
I love
Yeah, he's
him.
just a baby. He's just a baby. And
He's just a girl.
He's a queen. His parents, supposed parents, I don't believe that these were his parents. He looks nothing like them. That's besides the point.
Breeding.
Yes.
Responsibly,
Yes.
of course.
They were chained up outside and they had like 3rd-degree burns all over
my
their
God.
bodies. And they had a bunch of sores from the chains and everything that had tied them up. And the burns were from the sun because they were just constantly outside. It was so sad.
This was the parents?
Yes.
Oh my God.
And I feel like that's why Loki likes his cage so much because he was trapped in it for so long that is just like his home.
Comfy.
Yeah.
And that makes me sad. But I am unsure how this happened, but when I got him and then I went to go take him to get neutered, the original family that I got him from was there because they got to keep one of the puppies.
They got to keep one of the
They got
puppies.
to keep one of the puppies.
But they got one of them taken away.
So they got 2 taken away. One went to me, which is my perfect baby. And then the other one went to my friend that I had worked with when I coached gymnastics.
That's like the big gray area with animal abuse and neglect is like, it's really hard to do anything about it.
Yeah.
It's really hard for the authorities to do anything about it. Like, it's really hard if from what I understand, to a certain degree, if you abuse your animal or you neglect your animal, but then you bring them in and say, oh my God, they're so sick.
Yeah.
Please help them. And then you are willing to pay the money to take care of them and like prove that you will take care of them, then like they can't do anything about it. That's what I understand. But that's really weird.
Sorry.
That they were able to take
that's
2 away.
That's
And
what I was confused about. Like, why did
I wonder
they
if it's like the
keep
condition that
one?
they were in.
Yeah.
But yeah, that's the really hard part about animal abuse is it's so hard to actually prosecute. It's so hard to do anything about.
Yeah, on that point, I'm not going to speak about the details of the case that the other day was just horrid, but the owners were not allowed to own dogs, and they brought in a deceased pet
Oh,
that was theirs when they were not supposed to have dogs. So, like, on that point, like,
yeah.
you can try to say, like, yeah, you can't have a dog, but, like, who's going to enforce that?
Right.
Realistically.
Yeah.
That's why, like, I feel like when you adopt an animal, there should be better guidelines for that.
Some places have background checks and, like histories
I
like
had
that.
to get a background check.
Yeah.
Yeah, but, like,
Honestly, slay. Like,
for real.
go
Pop
off. On
off.
But most breeders don't.
Yeah.
No.
Or a lot of reputable breeders will have something like that. But most, when you go,
They say you got $1,200.
yeah,
Okay.
when you go to like an animal shelter,
money.
they do like a lot of rescues and stuff. Will do like home visits and like make sure your house is like, good for an animal. But I just went and bought my dogs.